So this next presentation is a brief overview on chelation. How do you know you need chelation, and when do you stop? And to start with, chelation should be done with a chelator that has high log stability constant for the metal in question, and that it works in vivo. So for gadolinium and lead, DTPA is an optimal chelator. It has very high stability. And I think a number, probably I would recommend also in the development phase for other chelators that target metals that are actually not well handled currently, like chromium, is the log stability constant should be over 20, and you have to demonstrate that if you take it, that it actually removes the metal, because there's a lot of drugs that show fancy formulas for getting into cells and taking out metals, mercury, and so on. But if it actually doesn't remove it from the body, then all of those fancy formulas don't mean anything. So 24-hour urine is easy to do, and I use it in all patients. I use it in all patients for gadolinium and lead, and it works for other heavy metals. If a chelator is working, whatever it is at baseline, so I do 24-hour prior to get a baseline, and then 24-hour post. So if something is working, it has to show considerable, some amount of elevation of the heavy metal post taking it. So post chelation, you have to show elevation. So no matter what the fancy thing is supposed to do, if it doesn't show increased removal of whatever heavy metal after taking it, then it's not working. So one of the problems, and I think one of the justifiable concerns and dismissals of chelation, is that essentially everyone has lead in their body. And if you were then to chelate everyone for lead with either EDTA, DMSA, or more expensively, DTPA, then it probably would bankrupt the healthcare system if it was covered by insurance. So you could understand the hesitation of doing that. So how do I know that I'm sick from a heavy metal? Well, with gadolinium, it's actually, of all the heavy metals, it's the most straightforward, insofar as you get the gadolinium injection, gadolinium contrast agent injection, MRI, and then most of the time, within a day, you start feeling horrible with symptoms that you didn't have before. Now, it may be, it takes a month for them to develop, but for most people, it's within a day. So that's clear cut. It's got to be gadolinium. You know, if you're fine before and then you get something, whatever it is, and you're really sick afterwards, you got to think, whatever it is, it was what I just got that made me sick. I mean, that's sort of just empirical. It's not even wisdom sense, it's common sense. So gadolinium is straightforward. The other ones are much more insidious, because you're not getting, you're not sort of taking eating a lead sandwich or something like that. So it's more insidious, and you have it in your body. So as with gadolinium, I mean, there are, and the symptoms are actually very similar. There's a list of symptoms. Many of them involve bone pain, skin pain, fasciculations of muscles, brain fog. If you seem, and depression is involved with many of them. If you have the symptom complex, to me, in fact, an easy test is to do a chelator challenge. But what should happen if you are sick? For instance, we'll use the subject of lead. If you are sick from lead, first of all, you should have symptoms. You can look up online, what are the list of symptoms for lead toxicity. If you think, well, geez, I have these symptoms, but, maybe I'm just feeling lousy because of work or whatever else. But how you know that you need chelation? You get pre-urines, chelator. Immediately after taking the chelator, you start a 24-hour urine collection. So if the metal goes up a lot, then that's something that's actually typical for lead. Everybody will show that who have lead in them. But these are the things. You look for the symptoms getting worse initially. So that is removal flare. So it makes sense. If something is making you sick, if you're removing it, and the way it's removed is it's being taken from the tissues back into the circulation and then out through the kidneys. So now the immune cells in circulation will suddenly see a vast increase in the amount of that metal. It has to make you sick if you are sick from that entity. So heavy metal removal flare is critical. Then what happens in week 2 is you do get a period of feeling better. And it may be initially after the first chelation, maybe it's just an hour of feeling better. But with each subsequent chelation, of course, as a side note, the duration and length, the duration hours in that day and the length of time over a course of days increases. But then at about 3 weeks, and it's remarkable how this is very consistent with gadolinium and lead, and I suspect it must be consistent with everything else that primarily has as a major reservoir bone. It's when it re-equilibrates. So that's Le Chatelier's principle of lead or gadolinium moving from bone back to where we took most of it out with chelation, which is the soft tissues. So at 3 weeks, you will get the symptoms returning. And I keep telling people, do not panic. That is a good thing to get the re-equilibration flare because it confirms to us that you have that toxicity. So that's what we look for. If you have lead toxicity, you have the symptoms, and of course the symptoms, the list of symptoms is like 20 or more. So you have symptoms that are consistent with it. You get a chelation session. You have heavy metal removal flare the first few days. Second week, hey, I'm starting to feel great. This is wonderful. But after the first chelation, it's transient. You start feeling worse again in week 3, which is really actually very critical. The re-equilibration flare is very critical. That is confirmation that you're toxic from that metal and you need chelation. So if we say everybody has lead in them in this country, which is true, so that's about 350 million people, probably the number who are actually sick from it is like what we see with gadolinium. It's about 1 in 10,000, 1 in 100,000 individuals. 1 in 10,000 have maybe mild reaction to it, and 1 in 100,000 have a serious reaction to it. So that's what tells you have toxicity from the heavy metal and you need chelation. Thank you for your attention.